I'm Dr. Danielle Litoff of Battleborn Health. We're continuing our series on jumpers. What's really important to get the mechanics of jumping is to know that you have the correct mobility and stability to be able to perform a jump. Because usually what happens is people get knee pain, but it's really coming from not being able to use their core, not being able to use their glutes and their hamstrings. So what you want to see is when you do a squat, and the reason I have my band here is because it really activates my glutes and my hamstrings. It makes me think about keeping my knees out. Like we talked about in the last video, people tend to come in here. So I really like doing these warm-up drills with a band so I can push out into the band and know that I have a straight line from my knees to my toes. My hands need to be up and I need to be able to control that all the way down. Now, if you have a problem, you find yourself on your toes, you find yourself down here like that, then you know you don't have the stability or the mobility to be able to do a jump and land appropriately. So some activities that you can do is if you can't do that, you can take a TRX, you can take a tie down on the door jamb, or you can even just hold on to the door jamb to give yourself some assistance. And you can hold this up. What I want you to be able to do is come down straight, arms up tall. Can you balance there for 5 seconds? And then come back up. So that's a really good way to kind of work on, you know, is one foot kicking out? Is one knee going in? Are my ankles having a problem with that? The next thing you want to look at, single leg, because single leg will show us our deficits. Can you go low on your single leg without your knee caving in, without your hips moving around? Same idea. If you can't, give yourself a prop so that you can take some of the weight off and really practice these low types of movements slowly with control. Then we can work towards having the control, the strength to be able to do those jumps later on.